the opportunity to come and speak. So we have now passed over to good afternoon instead of good morning. So, and I'm going to try to stay behind the podium so the camera can get me, so I won't be wandering around. If I wander, somebody will just direct me back in. But I'm going to go through, hey, how you doing? Seeing old friends and everything. A lot of things changed since I've been here. I was driving in and new buildings and finding places to park, and I was here back in 2002 to 2004, and there was no parking then either. So it's it's a issue that a lot of things have changed. But I want to give you a little quick background about myself, and then I want to go into some of the jobs that I have done with public health through the years, and also want to try to show you how the MPH has really helped me in my career in public health, and then we'll have some time at the end for questions. So I'm going to take my watch off like a preacher does so I can look down at it. I graduated, any of you from the state of Alabama, if you're familiar with Alabama, I graduated, where are you from? Montgomery, okay. I'm about 2 hours south of Montgomery is where I was born in a place called Escambia County. And my house is actually about 3 miles from the Florida line. So I'm as extreme South Alabama as you can get. I went to school at W.S. Neal High School, and when I was in high school, I knew what I wanted to do for my career. I wanted to be a teacher, and I wanted to teach science. So I was one of those that I knew that in 10th grade, and I had my plan, and that's what I did. So when I graduated high school, I went to the local, it was junior college then in town, got my associate's degree, and then went to the University of South Alabama, Mobile, and got my bachelor's degree in education. And at that particular time, this would be back in about 1988, there was a real need for science teachers and math teachers. So I wasn't worried about the job. You know, they need them, so I'm going to get a job. So I graduated, and then I began my interviews. Well, what I didn't really take into consideration is science teachers, they also need you to be the football coach, or you need to be the basketball coach. So I'd go for interviews, and everything would be good, and then they'd get that part and say, well, can you coach football? I said, well, I've never coached, and you could tell the interview was practically over. We just go through the motions. So I'd go to another one, and same thing. And finally I went to one, and the superintendent interviewed me. He said, well, can you coach football? And I said, no, sir. He said, well, do you watch it on TV? And I said, oh, yeah, I watch it. He said, well, you can do fine then. And I was like, no, I don't think so. Get on Friday night football, and you don't know what you're doing. So I finally interviewed at a private school. So after I got my degree, I went back home where I was born at and worked on the farm. I'm from an area that's real rural, real country. I grew up on the farm. So I got my bachelor's degree. I'm back home working on the farm. And I'm thinking, this is not what I had planned. It's not working out right. So I went for another interview at a private school. And it was in December, and they needed a teacher bad. So they interviewed me, and the headmaster said, I'm just going to offer you the job today. And of course, I was young and naive. I now look back on it, he needed me. He said, we're going to start you out at $11,000. And I was like, okay, you know, $11,000. But I said, I've got to get started. I got to start building my resume. I got to get my career going. So I accepted the position. Little did I know, I'm trying to paint a picture here for you, how things in life work, that sometimes you don't know why things are happening right now in your life at this moment. But when you get up here and you look back, you'll see how it all worked out. So as I took the position and began to teach, I was there 1 year. The father of two of my students worked for the Alabama Department of Public Health. And he come by one afternoon, and we were talking. He said, have you ever thought about, he said, I don't want to hate to lose you as a teacher, but have you ever thought about working in public health? And I said, well, I really don't know what public health is. I don't know what that is. When I think about the health department, at that point in my life, I was thinking about they give shots. That's where kids go, and they get the shots before they go to school to get their blue slip and all this stuff. Because either I missed the booths that were at career days when I was in high school about public health. I didn't visit them, or they wasn't there. I don't know. So I really didn't have a lot of knowledge about public health. But what did trigger my knowledge or interest at that point was he said, we've got a grant, or I guess y'all know public health, we love grants in public health. The health department had got a grant back in 1991 for a lead grant to hire some additional environmentalists to do some work with lead. And they were needing to hire some environmentalists, and my bachelor's degree in science helped me qualify for that position. So he said, if you're interested, I think I can get you hired. And I said, well, I think I'll think about it. He said, well, you'll start out at $19,000. And I was like, okay, I'm interested, because I'm making $11,000. Now I'm gonna jump to 19. I'm getting started, you know, I'm getting going. So interviewed for the position and got it. And that was in '91. And I started out in Escambia County, and I did Conecuh County as an environmentalist. We inspecting food restaurants. If you go to the restaurants now and you see the score on the wall, I did that. And if you've never, some point maybe you get to go back on an inspection with environmentalists, it's really eye-opening to go behind the counter, see what's happening back there where your food's prepared, but that's another talk for another day. We did septic tank work, we did rabies work, we did vector work. So I did that for about 14 years. During this process, I'm the type of person, when I do something, I jump in it and give everything I've got. I've always done that, and that's just who I am. So, my goals early on in my career was I wanted to advance within the organization, whichever organization it was I was going to be working with, whether it was a teacher or then I got into public health. I wanted to do everything I could for the organization. So every time an opportunity came available for, a memo may come out or email, we need somebody to work this event on a Saturday. We've got some funds, we need somebody to help us write this. I was like, I'll do it. I want to be part of it, because I was wanting the supervisors or the leadership of the agency to see some of my abilities, because I wanted to shine. When you get your career and you get started, be that person, be that when the leadership of whoever you're working with says, who is our rising stars, that your name pops up, that they've seen your work ethic, they've seen what you can do. That's how we'll help you advance. So I did that, and then our area administrator, and I will talk about our structure in a little bit. The way we're divided, we have like counties makes up an area. She told me one day, she said, this was in 2002 in February, I'll always remember. She said, Ricky, I see some work there, and I think you got some potential that you can help the agency in the years to come. She said, but I think what would really help you a lot is if you get your master's in public health. And I had my bachelor's, I was through. I was no plans to get a master's, and remember I didn't know anything about public health. And I said, okay. And so I went home and thought about it. So I filled out the application the next day. I said, if I'm going to do this, I'm going to do it. I filled it out, I put the stamp on it, and I dropped it in the mailbox, really just did it. Then once I dropped it, I couldn't get it back. I was like, okay, well, we'll see. Did you think this through? So, and then I got a call from UAB, and I had to go, I had to take the GRE, which was, I had been out of college for years. That was a mind blower for me, having to take that. It's a total different way of thinking. So I took the GRE, I did the practice exams, and I was like, oh man, I'm not going to get this, because it was like, there's 5 people in a room, A, B, C, D, and E. E is never talking to A, and B only sees C when D gets through talking to B, and I couldn't think like that. So I practiced, and I thought I was ready, so I took the test, and I got a call from Dr. Peterson at that point here at UAB, Donna Peterson, and she said, she was my advisor, she said, you didn't score high enough for us to accept you. She said, but what we're going to do, and I don't know how she went to bat for me or how all that worked, she said, we're going to accept you on probation. So they had some hope in me that I could do it, and then that's all I needed. If I could just get my foot in, get in. So I started in 2002 and just put everything I had into it to get this master's degree, and had some excellent instructors here that helped me, and graduated in 2004, 2 years later. When I did this, and this is not trying to penny roses on me, but for you to realize how far it has advanced. In 2002, there was no online courses. There was one that they piloted that year, if I'm not mistaken. That was the core curriculum. We could do that online, but we had to come once a month to meet in person as a group. So I would drive, it's 4 hours from my house. I would drive 8 hours round trip to come do my classes. And I was able to take some time off from work. I had some leave built up, so I had to use my annual leave. So I drove back and forth. Sometimes I would have my classes back to back, so I'd spend the night. Seemed like it was taking forever, but then once it was over, it's like, man, that happened so fast. How did that go so quick? But my time at UAB, I learned so much here at the School of Public Health. Even though I had been working in public health for 14 years in a county health department, I was the environmentalist. I was in the same building, and WIC was going on, family planning's going on, immunization's going on, we got STD going on, epidemiology going on, home health. I didn't know what all that was. I didn't know what they were doing. But now I can tell you how hot chicken's supposed to be, and I can tell you what to do if you got bit by a dog, or how to put it in a septic tank. So what happened when I come to UAB, School of Public Health, all this knowledge just opened up for me about the history of public health, where it come from, what all's happened, what all it does, and it's so huge, and it goes on and on and on. So it was really a career-changing move for me in so many ways, and I'll never forget my time here at the school, and it has made just a big difference in opportunities. So when I got my master's and I went back, just about 2004, I applied for some administration positions. I want to get into some leadership. So I was able to get selected to be an assistant area administrator, and I did that for 5 years. And then when the administrator retired, I was moved up to be the administrator over 8 counties. I did that for 5 years, and then I got 16 counties. And then in March of 2016, I interviewed for the Director of Field Operations position with our central office in Montgomery. So now what my job duty is, I'm going to go into more of it here in a little bit, is I'm over all the activities, all the services, all the programs that takes place at the county level in all the county health departments in the state. And I'm real blessed and humbled to be able to be in a position like this, because when I look back to my beginnings of a country boy deep in the woods, you know, and being able to have an opportunity like this, but all those things I told you at the beginning, not getting the teaching job, taking the one at the private school for $11,000, you know, not my expectations, but made a contact there with a father who got me into public health that I didn't know anything about, and then I just love public health. So things in your life happen. They may not happen at the speed we want them to, but just stay the course and stay with it. Okay, that's enough. That's a little bit of the history, so you know who I am. So now this is probably what you come to hear. The Alabama Department of Public Health, this is our mission statement and our vision statement, and we are in the process now of updating our strategic plan to go through 2023, and we're going to be changing these a little bit, tweaking them some. But if you're considering, I hope through my presentation today I will motivate you some to consider the Alabama Department of Public Health for a potential career when you finish up your degree. There's a lot of opportunities in every county in the state with our agency, and there's a lot of people in the state that needs public health. There's still a lot of things we have to address, and there's a lot of opportunities, whatever area you would like to go into, for you to do that. We were, prior to October of last year, the state, we are a centralized public health system in Alabama, so the Alabama Department of Public Health, our central office is in Montgomery. We have county health departments in every county in the state except one, and that's in Coosa County. And we closed the health department in Coosa County about 2 years ago now, and that was a very difficult decision for us to make because we didn't want to start that. Because it's like we knew once you start that, then you started the dominoes, that it may be a little bit easier to close the next county health department. So why did we close that county health department? There was the number of our numbers in the clinic were just dropping, and it's a real rural county. If you've done any research on Coosa in any of your papers or your studies or your classes, just no industry there, low population. We had gone from being open 5 days a week to eventually got down to 1 day a week, and then we went into a couple days a month. We were just trying to hang on. We had no staff that worked at the Coosa County Health Department that lived in Coosa County. Everybody was driving from other counties. So it reached a point where it was no longer financially viable for us to stay there and have a presence. So we looked around and see how far would those individuals that's getting services there have to drive to a neighboring county health department to receive services, because that's, again, we don't want to put up any additional barriers to health care that's not already there. So we had to close that county health department. So we did a reorganization to try to become more efficient and more effective in our services. The Alabama State Legislature is really looking at all state agencies now. Are you efficient? Are you effective? That's two words that's really coming up a lot in our work environment. Does the programs you do in public health, are they effective? Well, yeah, they're effective. Well, show me some numbers. How can you prove that to me? Well, I just know they are. Okay? So we had a problem of showing where have you moved the needle? What's the return on investment? So now, in a lot of things, you've got to have these benchmarks and you've got to have outcomes. We're shifting to that. So to become more efficient, more effective, we begin to look at our structure, how we're structured. Well, we're structured, I think it's my next slide. Our central office in Montgomery, we're like a pyramid. We got a central office, and then we come down to the district level. And the district level is each one of these colored sections. Jefferson and Mobile are separate. They have their own county boards of health, and they have their own county health departments. Actually, Mobile County Health Department was in place before the Alabama Department of Public Health. But we work in conjunction with them. We work together very mutually. So there's 6 public health districts now across the state where there was 9. So we're trying to streamline a little bit. This is where I'm from, down here in Escambia County, that I'm telling you about. And then when I was talking about Area 9, I was over like 8 counties right in here, excluding Mobile, and then I went up to grab 16. Each one of these districts now, we have like 10 to 12 counties makes up a district. And out of our central office in Montgomery, then we branch out to our districts. Each district has a district leadership team present there. So you got central office, districts, county health departments. In our county health departments, and I'm going to show you a little bit of the services we provide. We provide nursing care, we do family planning, we do immunizations. So within that district, there's a district nursing director that's over all the county health department's nursing activities. We also have administrative support assistants who do the clerical work. They do the intake, they answer the phones, they issue the vital statistics. We do divorce certificates, marriage certificates, death certificates. So there's a district clerical director in each district. Then we have an environmental program. What I did at the beginning, I was talking about the on-site work, the rabies work, the food work. So there's a district environmental director. So in each district has a district director for that program. And then you have supervisors that comes down to the next level that may be over 2 or 3 counties. And then in counties, you may have one environmentalist doing the work, or you have county health departments that may have just a 1 county nurse because it's rural. The productivity numbers, there's not enough demand there to have more than 1 nurse. Some other counties like a Baldwin, Houston, Madison up here, Tuscaloosa, our bigger counties, we may have 10 nurses. So it all depends on the size. So you have all that going on, and then you have your district level, and at the central office in Montgomery, there's your state program directors. Does that make sense? Sort of how we're structured. But this is our district map. Our county health departments, this is just for the county health departments. This is not including our state office. We have an annual budget revenue of about $134 million that goes to our county health departments that we bring in every year. About 1,500 to 1,800 employees. We covered the whole state, 485,000 square miles. About a 4.8 million population, back on the 2000 census. So it's a big area that we cover. And if you'll notice, these districts, this is a large geographical area. And when you're traveling from Washington County, Chatham, and you're coming up to Clark, it's 40, 50 miles to the next little town. So you get in these situations where we provide services, but due to the things that we can't control, distance and all, your cost goes up because you're paying the mileage to get your employee over there to provide the service. And we run into challenges that we are, as a matter of fact, we're working on now, we've been working on, but we just rolled up our budgets for fiscal year 19 that we're going into. And we're looking at spending down millions of dollars. So we're going to spend down our fund balance. We're going to spend more than we're bringing in. And the way I like to explain that is if you think about your own personal checkbook, you got your checkbook and you got a $2,000 balance that you want to keep in there, whatever your minimum is. You don't ever want to get below that. And so you've got $5,000 in it. So this particular month, you bring in $800, but you spend $1,000. Okay, so you ate $200 of your fund balance. You're okay. But next month you eat about spend $400 more than you bring in. You're still okay. But all of a sudden you look at your checkbook one day, instead of having your $3,000 balance, you're down to $1,200. Okay, so you start, hopefully by that point you're thinking, what am I need to do? I need to change a little bit. Don't need to eat out as much. I need to cut the movies off for a couple of months. I need to adjust my heat a little bit. You start trying to think of ways to save your money. And then if you get drastic and you got $100 left, you may say, well, I'm going to pull some out of savings. So you got $2,000 over there in savings, so you pull it over. Okay, that floats you for another month or two. But if you keep spending the way you're spending and not bringing in the revenue, the next thing you know, you'll apply for a credit card and you'll start charging when you go buy your clothes, and you'll start charging your meals when you go out and eat, and you pay that minimum payment. Next thing you know, you got a $3,000 credit card balance. I've got $100 in the checking account. I don't have anything in savings. You see? So if you can think about it that way, that's how it is with public health, with all businesses. So as we begin to work in some of these counties, and we have counties now that have a negative fund balance, which means they don't have, they don't have any money. It's in the red. But we help support the smaller rural counties from our bigger counties that have a lot of business to help keep the smaller counties afloat. Because if you look at what happened with Coosa, so if that happens with other places and we begin to close county health departments in locations where they're not viable or we can't keep the money balanced, and then we're closing in places where people really need us. If you stop and think about it. If you keep the bigger places open, that's where a lot of your population is. There's a lot of other opportunities for health care. It's the smaller places that needs us and needs our services. But that's some of the challenges we look at and face, in the leadership with the Alabama Department of Public Health, is balancing budgets. We only get about 6% of our annual budget comes from general fund dollars from the state legislature, 6%. The majority comes from federal grants that we're on, and we also have allocations. Some counties and some cities across the state give us money to help us provide services. About $9 million we get from allocations, but those are designated for that county. They want those county commissioners or those city councilmen want you to spend that money on those residents there, which makes sense. So only 6% of our budget, and the whole department budget is around, I think, $800 million. Only 6% comes from the legislature. Now, let me pause a little bit and let's talk a little bit here on the legislature. One thing with public health, and I know you're learning this in your classes, because I remember when I come through, we did the same thing. Once you get in your position and your job and you begin working, this political thing, working political relationships is a real thing. It's a real thing. Religious comes into play. You got barriers to health care, and you got travel problems, and you've got federal dollars that we get, but this is what you can do with them. When you apply for the grant and it comes in, this is all you can do with it. You can't use that to do clinic services. You've got to only use it to do TB, or you can only use it to do well child, or it may be just for the WIC program. So it's real stringent. You don't have much room to move around. You don't have a lot of financial flexibility. The only flexibility we really have is that 6% that we get from state dollars. What are we going to do with that? Well, we use it in different ways. Primarily, we use it to help fund services that we provide to people who don't have Medicaid or they don't have any insurance at all. They've got to have health care. Somebody's got to take care of them, and we do that, but we don't have any funds coming in to provide that care. But public health is a safety net. We consider ourselves, with the Alabama Department of Public Health, a safety net. See people has nowhere else to go. There's FQHCs, there's a lot of rural health clinics. We want to provide that service that's not being provided that's needed, and we have to do that. And juggling the financial part of it and the political thing, if we're going to carry a bill to the legislature, public health is something we want to get passed. And a couple of bills we've been working on last couple of years is a needle exchange bill. Okay, so when we bring that bill over to the State House, and we're talking to senators and representatives, and we're trying to get them to buy into it, and we're already meeting with all our partners, the ones that we know is going to be against it. We're going to bring them to the table. We're going to bring everybody to the table that's for it, and you have those conversations. You're building relationships. You're networking. And then you've got to get somebody to bring that bill up on the floor. And then when it gets brought up, their debate goes on. So you got to have good relationships, because if you don't, your funding can get cut. But that's a whole different lecture, I guess, on that. This is a real busy slide, but I wanted to put it in there. This is our organizational chart for the Alabama Department of Public Health. The Alabama Department of Public Health, Dr. Harris, who is a graduate of School of Public Health last December, I think. So he's a newly graduate. He's our state health officer. He's been with us. He's been in public health for about 3 years, but only 1 year as our state health officer, and doing a fantastic job. He is not a governor-appointed position. State health officer is not. Like a lot of state agencies, the governor appoints the director or the leader. In public health, the state health officer answers to the state board of health. It's good, or you may find it being bad. Different states do different things, but we're one of the few that has this set up. So the State Committee of Public Health, Dr. Harris, underneath Dr. Harris is all these boxes that covers everything we do within the department. And just for, here I am right here. So field operations, and underneath me is our local health services. That's all the activities that happens in the county health departments. Our clinical management and practice. This is our nursing division, our social work division, and our clerical division. Those are the three clinical entities that works together at each county health department level. So they fall under field operations. This box is community affairs. Carolyn Burden does that. That's our outreach efforts and working in communities, working with partnerships across the state. We're always looking for somebody to partner with. What can we bring to the table to assist with you in your program when you're doing something? Obesity, cardiovascular disease, diabetes. Can we help with that? Can we do some education with that? We got some social workers can help do this. So you partner with different groups, and that's how you get things done. And you're going to do that a lot in your career in public health. You're not going to get with one organization and just be you. You're going to work with a lot of different groups. And I remember when I came through, we did a lot of group projects, and you got to learn to depend on others, that they're going to do their part until you get to the finished end product. It made me nervous at the beginning, but I learned to do better with it. But in public health, you're all the time networking. You're all the time partnering with other groups to come together. So that's our community affairs. And then we have telehealth. This is new. It's probably about 2 or 3 years in existence, but that is really growing within our department. And we're actually working here with UAB. And his name, I see his face, he'll come back to me. But we're doing a lot of work in telehealth with across the state. We have telehealth carts in all the county health departments now, except I think 7. We increased our broadband width. We got and we partner with any way we can with telehealth. How can if someone having to come to UAB to see a specialist and they're in one of these rural counties, can they come to the county health department? Can you do it through telehealth? And then you won't have to drive so far.
I think we're doing that in nephrology. Right?
Yeah, Dr. Eric Wallace. That's it. Thank you. That brought it back. He is one of our big troopers with that. He did that and did some pilot stuff, and it worked out really, really well. Actually had back down, I think one thing is in Lowndes County, an elderly lady, 84, her and her husband were driving to Birmingham to see him, and he was able to do their visit through telehealth, and they're like 10 minutes from the county health department. So there again, that's removing some of those barriers to health care and providing access. Okay, this is basically taking the box for my position, what I do. Just want to break it down a little bit more for you. This is those 4 boxes that I just showed you that is underneath me. And we have an ASA support here. We have some more people working in telehealth. Then in our clinical management, that's your state nursing director, state social work director, state clerical director. All 3 of those work together because that's on our clinical. This is, I want to break down a little bit more that I was talking to you earlier about what goes on at the district level and the county health departments. Underneath, this is Director of Field Operations. The Chief Medical Officer, this is Dr. Mary McIntyre, who is also, I think, an alumnus of UAB, School of Public Health. Me and her work hand in hand. That's what this dotted line is. I do more of the administrative side of the clinical stuff that's going on. She's our medical officer for all the medical questions that come up in the county health departments. Underneath her is the district medical officer, and here is the district administrators. That's those people that I was telling you about. There's 6 districts. They're the individuals who are over all the stuff that's going on within that district. And here's each one of them. We have an emergency preparedness director. We have an environmental director. We have an assistant to the district administrator. You have your nursing director, social work, clerical, nutrition. So all those work together, and all that's going on at each county level. And then you got your disease control, immunization, HIV, STD, and TB. And I think I talked on that one. I want to get to, this is our nursing division, what we do. We have about 850 nurses across the state working in our county health departments, providing family planning services. They do child health, they do preventive treatment, they do disease control. One of the things we do is with disease control, when we have a positive case, we have to go and find the contacts and notify everybody to try to get those in for testing. So that's going on in the county health departments. across the state. And here's our social work. Our social workers do a lot of case management across state, patient first, plan first. And I know you've been keeping up with Medicaid and the changes that have occurred with them, what's going to do the RCOs for several years. I think that was about a 5-year plan, and it didn't materialize. And now Medicaid is looking at the Alabama Coordinated Healthcare Case Management Network. CHIN is the acronym for that. So we're not sure what's going to happen on that part for us as a department. What's going to be the role of our social workers, because it's going to be a case management pivot plan where an organization within the regions, identified regions across the state, will be bringing all the care coordination into one entity to try to be more efficient and more effective again. Same thing I was mentioning earlier with state government. Okay, this is some of the things that we do at the county health department level. We got a lot of things going on. It's not just like I mentioned earlier when I was younger and I thought we'd just giving shots to children. It's a lot more than that. We got the Alabama Breast and Cervical Cancer Early Detection Program that's available. We got biomonitoring services. This is where trying to keep people out of emergency rooms, trying to keep them out of nursing homes. If they're at home, elderly, living by themselves, they qualify for the program. We provide them the equipment to monitor their blood pressure, monitor their sugar, and they call in on the phone, and we monitor when it's elevated. We send someone out. So that's a preventive program. You know, that's some of the stuff that we struggle with in public health, is not persuading or influencing, but helping people, funding, and legislators, politicians understand, invest the money on the front end and do the prevention of public health will save us, as opposed to waiting until the full-blown disease then trying to treat it. I had a professor when I came through here at UAB, Dr. Alexander, explained it one day, and this has always stuck with me. He said, if you can envision it as a guy walking on a hill on a cliff, and he walks and he falls off the cliff and he falls down and he breaks his leg, then we put all the money down here to fix the broke leg. He said, we could have built a fence up here at the top of the hill for just a little bit of money, and he never would have failed to start with. And that sort of explains it. If we invest the money on the front end and do public health work, do prevention and do education and things that we can do to help, it won't ever get to the broke leg part. Birth, death, marriage, and divorce certificates you can get at the county health department as long as it occurred in the state. This was a big deal when it came about, because in the past you would have to drive all the way to Montgomery to get these for any county. Now you go to your county health department, fill out the application, and usually within 10 minutes you'll have your certified copy. Cancer detection, child health, Children's Health Insurance Program, CHIP, and a good plug here for us. We like to always say Alabama was the first state in the nation to get the CHIP program up and running, and that's something we're real proud of. Doing a wonderful job. We're always worried about funding. Is it going to be picked up? Is it going to be continued? It's always a stressor of that. Dental services, we do a lot of health education, work with dental groups in counties. We do have, I think, maybe three county health departments where we have a dentist on staff and we provide dental services. And a lot of those, again, were partnerships that we built with local trusts in the counties or local groups that wanted to invest some money and have a dentist available, and we were able to partner with them and get that done. Diabetes, we have diabetes branch disease surveillance outbreaks. We do a lot of investigations through the epidemiology when there's outbreaks, salmonella outbreak. We have an outbreak at a ballpark not long ago in Montgomery where teams were coming not just from Alabama, but baseball teams from the southern part of the United States, and we got some food that was bad. So we had a lot of people sick. We do those outbreaks and follow up on that. Family planning is provided at the county health departments. Food and lodging, we inspect all the hotels, all the restaurants. We inspect county jails. Now that'd be a good trip for you, go to a prison. That's an eye opener. I did that for several years. So we inspect prisons, we inspect camps where people go, anywhere where the public stays. HIV/AIDS, home care services. We do provide home care services in all the county health in all the counties across the state. Immunizations, yes, we do immunizations. Not as many as we used to. We have some of our programs that has declining numbers, and we're constantly trying to think of ways to how to get the clients in. What can we do to get clients to come in? and we do a lot of advertising. We call on the phone, we make your appointments, we work with social workers if they don't have a way to travel, to get them some travel certificates through Medicaid, all the time trying to think of ways to get people to come in and get services. Insects and animal nuisance that transmit disease to human, roaches, rats, vector control, we do those at the county level. We have a state lab where we do a lot of testing of all different types of samples that are sent in across the state to our laboratory. Nursing services, nutritionists, WIC. I know you learned about WIC, the Women, Infant, and Children's Program is a big part of what we do. It's probably one of our biggest programs. On-site sewage disposal systems. If you've done any work with that, you understand the importance of that. Not everybody is on a city sewer system. You know, when you go to the restroom and you flush it, most time you don't worry about where it goes, but if you're in a rural area, you worry about where it goes. It's got to go into a septic tank, and it's got to be broken down, and it's got to go out into soil and be absorbed. And if you've got bad soil, then you're going to have a mound system, which you may see these like 2 or 3 feet above ground. It's very, very expensive, and usually it's very hard for people to come up with the $10,000 to $12,000 to put in that conventional system when they're only making $18,000 a year. So that presents a lot of challenges. Sexually transmitted diseases, trying to hurry here, talking too much. Solid waste, telehealth, tuberculosis, we do private water wells. Here's my contact information. I have got some stuff that I wanted to, I got just a few minutes here. I have my card. If anybody want to stop by, feel free to get this card. If there's anything I can do to help you, if you're interested in working with the Alabama Department of Public Health, if you are working on a project for one of your classes and you need something about STD, or you need to know something about our WIC program, or you want to know something about our diabetes program, shoot me an email and I'll get you in contact with who can help you. I'll be glad to do that. And also, this sheet here it's got all our services that we provide at the county health departments on here, so you can see them and what they actually are. I thought that might help you in some of your classes or some of your projects that you'll be working on. I've got some information about telehealth. If you're interested in the counties where is telehealth available, and it's on here, and we got some of our partners that we're partnering with, if you're interested in that. Got that. And then also have got, I'm going to do a little plug here, do a little recruiting. If you're interested in working with the Alabama Department of Public Health, our application process can be a little troublesome. You can't just sort of see an ad in the newspaper and go apply online real quick. There's a process to it. You've got to fill out an application, and you put down the title that your job that you're interested in, and you can go to state personnel, and it's on this yellow sheet, get you this, and you find all the state jobs that are available, and you can click on it. It tells you all about that job. It shows your starting salary and how much you can top out at, what the qualifications are for you to qualify for that job, what that job does. And so you fill out an application for every job you're interested in. You can't just fill out one application and say anything I qualify for. No, you got to be specific and tell them what you're applying for. So you may send in 10 or 12, but once you get it filled in, you don't have to change anything but the title. You just save it and send it over and over. So you send your application in, state personnel will take it, they'll grade it. They got a process. Some of them require you to take a test, others don't, but they'll grade you on education, your experience, all this stuff, and you comes up and you have a number and you're placed on a register. And you tell them on your application where you're willing to work. Back over there on that, where all the counties were, you can say, I only want to work in Birmingham, I only want to work in the south part of the state, or I'll work anywhere in the state. I just want to work. Then that's what register they'll put you on. Then, when you're on the register, you're good for 2 years. Once you get on the register, you're on it for 2 years. So then when we have a position that we're going to fill, say we need to hire a assistant district administrator or an epidemiologist or an environmentalist, we'll write state personnel and say, I need a register. They'll send us the register. Then everybody that's on the register gets a letter from us telling you, you got an opportunity to come interview if you'd like to. So that's how you would be notified. Then when you get your letter, then you can decide, well, I don't want to go interview in Wilcox County, or yes, I do. But I just want you to understand, it takes a while for you to fill out your application, for state personnel to grade it, then to get you on a register. So as you begin to get close to your graduation date and you're ready to start working, about a month out, I would go ahead and start filling out some applications and let that process be taking place. Because if you wait, you graduate, and somebody tells you, oh, I hear public health's fixing to hire 10 epidemiologists. Well, if you start right then, it's probably a couple months, and if we're pulling for a register the next week, you're not going to be on it. So I'm saying, so go ahead and get on it, and you're good for 2 years. But this also, and we'll come back, this also has our benefits. We got good insurance, we got good retirement. It's all broken down on here. We got 13 paid holidays a year. You get about 13 days of annual leave a year. You accumulate sick leave. So working with state is a good job. It's Monday through Friday usually. Sometimes we have emergencies. But if you're interested in this, I'll get you one of these yellow sheets.